The following program aired about 4 years ago.
Live in Benton, Kentucky. I depend upon the ACA because right now I'm not a full-time employee. I work part-time. I'm a substitute in the schools, and I'm also a student in seminary pursuing a second career, which I am very excited about. So it is because of ACA that I have the freedom to pursue my dream, do something different, and look out for my family. My husband has health issues. He can't drive, and he has several medical appointments, so it would be very hard for me to work a full-time job. So it has been very beneficial to me. I get supplements from the government. I'm not on Medicaid, but I do get some help from the government, but I still have a pretty high premium, pretty high deductibles. And so I still have medical bills, so that it is not a free ride. And so single payer would be the best answer for everyone involved. Even though I have insurance, I have really bad knee issues. They need to be replaced, but I can't do it because I do not have the funds saved up to do something like that, to commit myself to something like that. So single payer would allow me to live my life to the fullest.
Thank you.
Hi, my name is Mike O'Connell. Feel very passionate about the concept of a single payer health system. I think it's the only way that we in every state and in this country can find a way to ensure that every citizen of the United States of America has adequate and competent health coverage at a reasonable rate, fashioned around a formula that everyone can afford and everyone will be covered. And it won't be just for those who have the money to be able to buy the best health care they can. And I think that a healthcare system run on profit per se and with an idea of dividends to pay to shareholders is no longer workable in this society as it's, and I think worldwide. It's just not an answer, and I hope that eventually we'll see this happen in Kentucky and all over the country.
Hey guys, welcome back to Single Payer Radio. Yes, you heard that right. We're returning to Forward Radio WFMP 106.5. I'm Mark McKinley, a volunteer and sustaining member here at Forward Radio. And just to let you know that Single Payer Radio is a project of Kentuckians for Single Payer Healthcare. We are an affiliate of Physicians for a National Health Plan, Kentucky. And some of our new shows will feature Doctors Mike Flynn and Gene Shively. With over 100 years practicing medicine between them, these two surgeons, they'll be bringing their unique perspectives about our for-profit healthcare system and why we need to move to a Medicare for All system. Dr. Flynn practiced in the Louisville metro area, and Dr. Shively out of the Campbellsville, Kentucky area. We'll keep you posted on our scheduling info. In a new study, Yale scholars have found that Medicare for All will save more than $450 billion a year and prevent 68,000 deaths every year. The study appears in The Lancet, one of the oldest and most prestigious peer-reviewed medical journals in the country. Allison Galvani joined Amy Goodman and Juan Gonzalez for a discussion of the study on February 19th on Democracy Now! You can go to Democracy Now! And check out that conversation. Ms. Galvani is the director of the Center for Infectious Disease Modeling and Analysis at Yale School of Public Health. She's the lead author of the new Lancet story called Improving the Prognosis of Healthcare in the USA. You can see that study at Lancet, that's LANCET.com. 37 million Americans without health insurance and 41 million more have inadequate access. Medicare for All will address these problems as well as eliminate bankruptcies related to medical debt, the co-pays, the deductibles, and the obscene rip-off profits by the current system. And in these pandemic times, please support our local businesses. You can buy gift cards or order carry-out, and please consider supporting this volunteer-driven community radio station, WFMP 1065 Forward Radio. As you know, it's stunning the difference in reporting between corporate media and our nonprofit station. If you value what you hear at WFMP 106.5, please go to forwardradio.org. We're approaching our 3rd anniversary on the air, but this pandemic is creating havoc with the pledge drive and fundraising campaigns we're planning. Become a sustainer. $5, $10, or whatever you can give each month. It all matters. So go to forwardradio.org. There's a donate button there. It's easy and secure. And Kentuckians for Single Payer Healthcare is a proud community supporter of Forward Radio. Now for a little time travel. What follows is a segment from the first episode of Single Payer Radio. It was recorded about 4 years ago in the studio we had over at the First Unitarian Church before we transferred over here to Hebron. As always, the views and opinions expressed during the interview are those of the speakers and not necessarily Forward Radio and our sponsor, the Louisville chapter of the Fellowship of Reconciliation. The legislative bill discussed in these interviews, 676, is no longer a House bill, though other single-payer bills are currently proposed. Now, an interview with two of my superheroes, Tom Moffett and Harriette Seiler. We lost Tom, but what a force.
Hi there. Forward Radio is pleased to bring our listeners another segment exploring the merits of a national single-payer health plan. My name is Harriette Seiler, and it's a great pleasure today to be speaking with Tom Moffett, a retired Presbyterian minister, well known in the Louisville area for his work as an activist for civil rights, open housing, and other social justice issues. And I've just learned that Tom also had a second career as an accountant. Tom, why have you joined Kentuckians for Single-Payer Health Care?
Harriet, I'm an enthusiastic member because single-payer, Medicare for all, is a way to combat the fear that millions of us have, the fear that a major illness in our family will wipe out our life savings. Moreover, single-payer is real reform that will expand care and cut costs. This program will save the average middle-income family over $5,000 each year. That's right, $5,000 per year. Businesses, too, would save. Employers would no longer have to pay health care premiums to cover their employees. They will pay a moderate tax instead, but the savings will be significant, and every worker will be covered. Small business owners who now say they can't afford health care for their workers would be totally relieved of that concern. Money would be freed up for expansion, innovation, even for higher wages.
And we could all use higher wages, couldn't we, Tom? I know how active you are, Tom, but how would a single-payer plan affect you, yourself, now that you're out of the regular workforce?
I'm 92, still healthy, but have had recurring EMS trips to the emergency room. With Medicare and a supplement, I've never paid more than $100 for those trips, and my taxes, premiums, and other minor out-of-pocket expenses probably come to less than $5,000 a year. But I wouldn't need to pay for a supplement anymore, and I'd expect my taxes to go down.
Well, like higher wages, lower taxes are always a good thing. A moment ago you mentioned real reform. Aren't the reforms that were brought in by the Affordable Care Act, also called Obamacare, aren't they helping with access to treatment and cost control?
Well, Obamacare has helped some. It has helped some people, but not a lot of others. And the Medicaid expansion has helped low-income families. But I know young people and people under 65 who are still struggling to get care, who can't afford the premiums, or especially the rising costs of their drugs.
Right, drugs.
Just imagine how things would improve under a single-payer system. Here it is. We'll all be able to go to the doctor of our choice without worrying about the bill. If the doctor decides we need care, we'll get it. There will be no interference from insurers. The doctor or hospital won't have to worry who will pay the bill or whether the bill will get paid, because the bill will be processed by the one single payer that will handle all payments for everybody all over the country. The money will come from taxes spread over all the nation's people and businesses. We'll all pitch in.
Well, now that sounds like the single-payer motto. Everybody in, nobody out. And in your view, what do we have to do to get such a system?
Well, it won't come unless ordinary people like you and me work for it, Harriet. There's a bill in Congress right now. It's been there for a number of years. H.R. 676, the single-payer bill introduced by Representative John Conyers. That legislation outlines a simple and common-sense solution. The bill now has 62 co-sponsors,
62.
including our own Kentucky John Yarmouth. We have to put pressure on Congress, though, to get it passed. The bill is an American version of the single-payer health care systems currently working smoothly in every other advanced industrialized democracy. Their doctors are satisfied, paid well, and the resulting care is better than we are getting, even after the progress made under the Affordable Care Act.
Better care than we have in the great U.S.? But Tom, don't we brag about having the best health care in the world?
Oh, we do have great doctors in hospitals, but for the last 20 years, health care costs have been spiraling out of control, bankrupting individuals and businesses, even while our costs have reached double those of other countries. That's right, double. Our health outcomes do not measure up. In 2000, the World Health Organization ranked the U.S. at number 37 compared to other member countries.
37th? 37th?
Shocking, isn't it? I'm afraid that outcomes haven't improved much. For example, we have higher infant mortality, lower life expectancy. The health of Americans, by many different measures, is actually worse than the health of citizens in other wealthy countries. That's a quote.
Well, and I also have heard that in some of our Kentucky counties, the mortality rate is shockingly high, which means we are losing so many people too young, so many needless deaths.
Such sad statistics, so many needless deaths. The facts have convinced me to be an active supporter of single payer. The U.S. is the only industrialized country without true universal health care. Medicare for All, H.R. 676, that's expanded and improved Medicare for All, will bring justice and care for everybody at less cost and will save our economy billions per year.
Well, now, how you and I are behind this, how can we get the public behind single payer?
Well, public support for this single payer is rapidly growing, and I'm convinced will soon force action on the political scene. I may be more optimistic than some, but the most recent national poll, December of 2015, shows a total of 58% in favor of an expanded universal form of Medicare for All. And that includes 30% of Republicans.
Goodness.
20,000 doctors nationwide have endorsed single payer as members of Physicians for a National Health Plan. Several presidential primary debates gave this its attention, but most media still ignore or criticize single payer as politically impractical. We know that Democrats as well as Republicans see problems and express public dissatisfaction with the ACA, commonly called Obamacare. But the media fail to mention single payer as a possible fix for a health care system that most of us are fed up with, unhappy with.
I agree that the ACA falls short of our expectations. It's just so complex, and I'm afraid the marketplace really doesn't work very well in healthcare. But let's get back to the costs of a plan like H.R. 676. How will we pay for it?
Well, there are wild statements being made, but serious economists who look into the question carefully tell us that single payer will save money and cost substantially less for everyone except a few of our wealthiest taxpayers, that top 1 or 2% we hear about these days. Opponents try to convince us that taxes will rise for all income groups. I have no personal hesitation in saying that I have checked out those major allegations and find none of them backed by any efforts to provide factual support and evidence. For instance, the claim that the platform proposal of a major Democratic candidate would require additional taxes of $15 trillion completely ignores the fact that the substantial increase in total taxes for health care will be more than offset by eliminating all insurance premiums as well as copays and deductibles. That's why all reliable estimates predict total costs will decrease, and I am confident in repeating that figure of $5,000 savings for the average middle-class family.
Well, and Tom, we have the savings in dollars, and that's to say nothing of reducing the anxiety and the worry about getting a health care bill that you know you can't pay.
That's right. I'm glad you mentioned that, Harriet. We don't worry about getting a bill if we have to call the police or the fire department. We can also take the worry out of health care the same way. The 911 dispatcher doesn't ask if we have insurance.
You're right.
Thank heavens. With single payer, if our doctor finds we need care, we get it and can still come back again and again. No consultation or cancellation by an insurance company to protect their profits.
Well, Tom, you have really done your research here, and we've about, I think, covered the waterfront. But is there anything else you think our listeners should know or that they should do?
Well, I've completely failed to mention one of the most important things. The reduced costs of single payer make it possible to include coverage of dental and even long-term care. Think of that.
You mean nursing homes, long-term care? That's incredible.
That is incredible. most of us have never even thought about that.
Right. People
And
have not
I
planned.
personally have always just accepted the fact that I was going to have to let Medicaid take care of my last days if they ended up in a nursing home. Remember, if we want to get no-worry health care, this kind of health care at less cost for businesses as well as individuals, you and I will have to get enthusiastic about it, join with others to work for it. The special interests that rake in huge profits from the current system based on private insurance spend billions of those profits to persuade Congress to leave our current complex and costly system just the way it is. Our votes are the only thing that can win out over those dollars.
Well, Tom, thank you so much for your insights and your passion about this topic. Listeners who want to support this movement are invited to join Kentuckians for Single-Payer Health Care, which meets the first and third Thursday of each month at the Louisville Free Public Library at the main branch at 301 York Street, downtown Louisville.
Tom also came into the studio for a live program that we did. And it's also time to tell you that on today's episode, we've got activist extraordinaires Tom Moffett and Harriette Seiler. And Tom, one of his careers was as an accountant working over at Park Duval Community Health Care Center. So Tom was in the throes of dealing with insurance companies and what that's about. But Tom, you've got decades of working through some of these proposals when President Reagan took a chainsaw to human services programs and did his tax cuts and the military spending. How do you keep people energized and engaged to continue to stand up for what's right?
Well, I think probably the most important thing is to keep them in touch with the people most effective. It's one thing to hear about it, and it's another thing to be in a personal contact with someone who is going through it. And that's probably the most helpful thing. Another thing is to not ask people to do what they're uncomfortable doing, find what they are comfortable doing, and give them the feeling of being successful at whatever it is they try, and be sure that the small accomplishments are celebrated, and but there is just no substitute for being person to person with people that are directly involved, and it's not always that many of us have not had that experience, and we need to reach out and find ways to get in touch with those people. So that's one of the main problems. And it's also very, very important to recognize the small victories that we are able to win. We can't always win the whole war, but there are along the way small victories that count for a lot.
Well, I think one of the ways as far as staying in touch with people who are affected by the cuts and effective in organizing can be with an organization like Kentuckians for Single Payer Health Care and our outreach and collaboration with other folks. Harriette, do you want to talk a little bit about I look at what this organization is involved with, and it's like whiplash, all the different directions that we're going in.
Well, of course, as Tom says, it's important to find out who can help and to talk to people who have the stories to tell, and to find people in government too who might listen. Yeah. I think that's very important. And education, because you remember when people were saying, you take the government, you don't let the government touch my Medicare. I don't want the government in my Medicare. Well, it was funny, but it was sad. It was because they didn't understand. And so a lot of our people simply didn't understand. And that's happening to the people, a lot of people who voted, not as I voted, but who didn't realize that their health care was going to be harmed by this administration. So let me talk just a little bit
Sure.
about Kentuckians for Single Payer. This group, I joined in 2004, but it was in operation before that, advocating for single payer, not a multi-payer system with all kinds of insurance companies, and every insurance company, for example, in the exchange, they have subcategories and different plans. The thing is that these multiple payers, take between 20 and 30% out of our health care budget. They take 20 to 30 cents off every health care dollar. But you want me to talk about, I sometimes go off on a tangent. I know you
Harriette,
want me.
you're good.
Yeah,
You're
you
good.
want me to
You're
talk about our
always
organization.
talking about-
Well, we invite listeners to join us. We meet the first and third Thursday of every month at the Downtown Public Library at 5:30 in the evening, and we try to be done by 7. And we share what we know about what's going on in the state particularly and nationally. And today, our chairperson was invited to Washington to be part of John Conyers' press conference announcing that they have the highest number of co-sponsors for the single payer bill, H.R. 676, that they've ever had. And I remember when our own Congressman John Yarmouth signed on as a co-sponsor, I think it was in February, and there were maybe 60 then co-sponsors. Now there are 111 Democrats
Wow.
who
Wow.
have signed on. And that is so exciting. And Kay Tillow, our chair, who kind of cut her teeth in labor politics and labor organizing, who cares passionately about single payer, was there. And also we are now going around to some of the town hall meetings that various legislators are having, Democrats and Republicans, and distributing single payer information. And lately we've heard of a few where as soon as single payer is mentioned, the whole room erupts in applause.
Fantastic. Harriette, you talked about the administrative, the layers of administration that take money away from direct services for healthcare, and they go into other directions for that money.
Right, advertising and
yeah.
marketing.
I just happen to have a couple statistics that the insurance overhead in the U.S. private market is 15 to 20%. Hospital administration, 10 to 15%, and then you give the commissioners, the agents who are selling plans, And I know that they have to feed their families,
Right.
but that's another 3% out of the dollar for health care.
Right. Now, we
and-
want those people to have
Yes,
jobs,
yes,
but our
definitely.
bill, of course, will provide for transition and 2 years of salary.
Absolutely. And just to compare the Medicare administrative cost,
Right.
3 to 4%. that-
Often just 2%.
Yes,
Yeah, right,
and I use the higher number
right.
versus 15 to 20 with a private insurance market. The per capita hospital administrative cost in Canada are $158. You drive across the border into the U.S., and that per capita hospital administrative cost $667. It's just the deal. A single payer system in Canada, annual healthcare spending per capita, $4,500 in Canada, $8,700 in the U.S.
Oh, well, and we're headed towards 9 and 10.
Yeah, and that's from the Fix-It film that we promote, and that's been a few years ago.
Right.
And medical costs have not gone down.
Right. And I'm sure Barbara will talk, our physician friend, member, will talk about the costs that are added to every doctor's office, every physician's, every therapist's office, every phone call that has to be made to an insurer who may deny or delay.
And
Treatment.
talking about dealing with insurance regulations, Tom, it's one of your careers was over at the Park Duval Community Health Center, working through that paperwork that takes away from servicing medical services. Can you talk?
Well,
what you
Mark, when I first went to the Park Duval Community Health Center, I had never been involved in health care before, and I didn't know much about accounting, but the first lessons I learned were that insurance was a mess, that everything else that we did at Park Duval Health Center was easier to get paid for than the insurance patients. Even the people who had to pay their own bills, we got better results from them than we did from the insurance companies. That was partly because it was just so complicated, and we were new, and we didn't know how to do it. But as long as I was there, it stayed there at the bottom, that insurance was the least, we got the least return from insurance, because every insurance company has different forms, and it kept us scrambling just to learn what the latest form for this. There were 4 or 5 insurance companies that we could keep up with, but then a whole dozens of others that we didn't have as often to deal with, and when we did, it just threw us for a loop.
My name is Ashley Hintz, and I support single payer because my 10-year-old was born with a congenital heart defect, and if the GOP have their way, my son will no longer have insurance or be eligible for insurance, and I don't think that that's an appropriate way to handle our future.
Support the single payer because I believe that everyone deserves to have health care and shouldn't be hung out to dry just because they can't afford it, and everyone should be working with each other.
So I'm a nursing major, and I've seen healthcare from multiple sides, and it's a lot more expensive to come in to an emergency room and be treated for exacerbation of like a lung disease or a kidney disease, when that could have been prevented a long time ago if you had been going to your clinic normally. But some people, if they don't have health insurance, they can't do that. So it's really important to reach out and try to get basic forms of health care for people that may not be able to pursue it themselves. So you have to extend your reach.
Very good. Thank you very much.
Oh, I'm Sarah, and I think that single-payer healthcare should be in the U.S. because it works really well in other countries, and I believe that healthcare is like a right, not a privilege, and everyone should have access to healthcare, especially in a really advanced country like the U.S.
Big turnout on this beautiful, chilly morning. Thank you for joining us. I'm going to try to get everyone come over here in front of the podium or behind me. Ask those that are going to speak to join me here behind the podium. Again, thank you so much for being here. We're on a tight schedule. The bus does have to keep rolling, so we want to allow maximum time for our speakers here this morning. I want to welcome you. My name is Bill Wagner, and I am the Executive Director of the Family Health Centers. I want to welcome you to the historic Portland neighborhood and our beautiful campus here. We're honored and excited to host the Save My Care bus tour and rally here this morning. I think you'll agree that the news that's coming out of Washington has been alarming in recent days, and the actions that have been taken by Congress and the President's executive order to repeal the Affordable Care Act have created a climate of fear and uncertainty across the land and here in our community. And we can't stand idly by. At the Family Health Centers, our mantra has become, don't agonize, organize. So when we heard that the bus tour was coming to Kentucky, we jumped at the opportunity to join forces with our colleagues around the country to help give a voice to the individuals, families, and the healthcare providers who have benefited from the reforms, the protections, and the coverage expansion under the Affordable Care Act. To help give a voice to those who stand to lose so much if the Affordable Care Act is repealed and not replaced at the same time with something just as good or better. Kentucky has benefited more than most any other state from the Affordable Care Act. More than 100,000 people here in Jefferson County have gained coverage, and tens of thousands more have benefited from the protections under the law. More than 12,000 of our patients at the Family Health Centers now have insurance that were uninsured before. And today and in the weeks ahead, we need to send our message loud and clear to our congressional leaders in Washington to protect the gains we've made under the Affordable Care Act. But there's one congressional leader that we don't need to send a message to because he already gets it. He stands shoulder to shoulder with us on this issue. And he's here, as you can see, again today. We're so fortunate to have as our representative in Washington, Congressman John Yarmouth. So again, please welcome John to the Save My Care mic. I think this is the one you want to use. Okay.
Well, thank you, Bill. Thanks to all of you for being out here. Over the last couple of weeks, we've had a couple of really interesting debates in Congress. The first one was when we were debating the budget resolution which the Republicans are using to do the repeal portion of the Affordable Care Act. And what we did during that debate, which I was proud to lead, was every time a speaker for the Republicans got up in the House, we had the data to say, I would like to remind my colleague that the vote you will cast today will take away insurance from 500,000 people in your state, will kill so many thousand jobs, and will cost your state so many $1 billion in economic activity. And it was really a forceful presentation because what we demonstrated was that there is a real cost to every citizen if you repeal the Affordable Care Act and don't replace it with something that is the same or better. And believe me, we've seen day after day after day, when Republicans talk about replacing, they have no clue what they're doing. And just the other day at the Republican retreat in Philadelphia, there was a secretly recorded discussion in which they basically said, we have no clue what we're doing. We have no consensus on where we're going, and we better be very careful because we're boxing ourselves in to a very serious situation. We already know that. We already know that because we had the most successful implementation of the Affordable Care Act of any state in the United States. Not only have I been able to talk with Bill about how much the Affordable Care Act has helped the community health centers in this community, how many additional people they've been able to serve, how many more medical personnel they've been able to hire, how they've improved the health of so many of the people who visit here. But we know from the public forum we had 2 weeks ago when 500 people showed up to talk about their experiences with the Affordable Care Act, to talk about real-life examples of what's at stake if there's a repeal of the Affordable Care Act. I think some of you were probably there and heard Steve Riggert, a man who has just been diagnosed with pancreatic cancer, talking about the fears that he has that he won't be able to take care of his daughter, who up until now has been able to stay on her parents' policies and will till she's 26. She had pancreatitis, has been in the hospital 20-something times, and he's obviously with a very, very negative prognosis, is still worried about and can't sleep because of the threat to his daughter's future if the Affordable Care Act is repealed. That's not one of the newly insured people that we talk about all the time. That's your neighbor. These are the people who've already had insurance. And that's why we say this isn't about the 30 million people who will lose coverage over the next few years if they repeal the act. This is about virtually every American losing protections that they gained under the Affordable Care Act. I don't want to go too much in the weeds, and I know we're in a tight schedule, but we just had a hearing in the Budget Committee this week on the Affordable Care Act. The majority, Republicans, got 3 witnesses, we had 1. The 3 witnesses spent virtually all of their time, the majority witnesses, all of their time talking about problems with the Affordable Care Act. They had no proposals to make it better or to replace it. None. And the reason is, as I've said many times, there are only 2 options to the Affordable Care Act. One's to go back to the era before the ACA when insurance companies decided who lived and died, and the other is to go to single payer. And it's kind of funny, every time you have a discussion about problems with the Affordable Care Act, and believe me, there are some problems with the Affordable Care Act, you say, that wouldn't be true if we had single payer or Medicare for everybody. So in a way, and I'm going to give you a hopeful sign and then leave, in a way, this debate's very useful because I think it's illustrating the prospect of how good the prospect of going to a single payer would be, and that it is the only option to what we're doing now. And the inability of the Republicans and the Republican machine, you're looking at Heritage Foundation and Cato Institute and the Koch brothers, and you name all of those great institutions that they rely on, they haven't come up with an alternative to the Affordable Care Act. You'd think in 6 or 7 years of trying they would find something. But the reason they can't is because single payer is the only option. Now the hopeful ending. I don't think they're going to be able to repeal the Affordable Care Act. There are already about a half dozen Republican senators who say that they won't vote for a repeal without a replacement at the same time. And believe me, they are not going to find a replacement. They've admitted that. So I'm really skeptical of their ability to do what they say they're going to do. But that doesn't mean we can lie back and say that and be complacent because they're going to keep trying, and Donald Trump's going to keep trying. So we need to keep our voices strong and loud. We need to make sure that we shut down, whether it's Matt Bevin's phones, his Twitter account, but the same with Mitch McConnell and Rand Paul and those other Kentucky representatives and the ones across the river in southern Indiana. These are all people who need to hear from us because they're all served by the same healthcare system. They all represent our neighbors in Kentucky, and we need to make sure that all of us stick together to stand up for our neighbors, whether they're in Louisville or not. So anyway, thank you for all your energy. Thank you for your commitment to do this. This is a fight that not only is worth fighting, it's a fight that must be fought and must be won. Thank you all. God bless you.
Congressman, thank you so much for all of your work. We have a number of other elected representatives here this morning, some of whom will come to the mic that we want to just acknowledge them this morning. Representative Jim Wayne is here. Jim, thank you. Mackenzie Cantrell. Representative Darren Lowen. Thank you. And Representative Joni Jenkins. What we will do now is I am going to invite a number of speakers, both consumers and providers, mostly doctors, here to the podium to tell you their story. There'll be just about 3 minutes per speaker. Then we'll invite Emily Beauregard, who's with the Kentucky Voices for Health, to talk to us for a moment, and then we'll have an open mic if anyone else would like to come up and share their story. So we will begin this morning with Tia Tabor. I haven't seen Tia. I'm not sure if she's here. She was signed. Emily, do we know if Tia is here? If not, we're going to ask Dr. Eli Pendleton to come to the podium and to join us. Thank you.
Good morning. So, my name is Dr. Eli Pendleton. I am a family physician here in Louisville, Kentucky. I honestly have lost track of all the individual patients that I've seen affected by the ACA, by the ability to get insurance, by the ability to get care for themselves. I've had people come to me who have finally been able to have insurance and they want to quit smoking. So we help them quit smoking. I have had people who have had wildly uncontrolled diabetes come. They finally have insurance. They can finally afford their medications. We finally help them control their diabetes. My wife Amber is here this morning. She's a pediatrician. She's had children who have had all sorts of chronic illnesses. They have parents who don't have insurance. The parents' illnesses affect the kids' illnesses. She calls me up. We get the mom into my clinic. All of a sudden we take care of her. The kids benefit as well. So the examples are numerous, and we can always remember individual. I have one guy who came, he got insurance. All of a sudden he was able to get into physical therapy for his low back pain. He wanted to go back to work. He was able to go back to work. I've had all sorts of people come in and be able to finally get the care that they really want. Frighteningly, currently, I have a whole bunch of people, or just months ago, had a whole bunch of people coming in trying to get as much care as they could possibly get quick before the end of the year because they weren't sure what was going to happen next. And that amount of uncertainty is really frightening. People have been able to climb out of their own health problems and really feel like they're taking control of their life and their health again. And now they're fearful that they're going to end up back where they were before. And, we're going to have to break out our sliding fee scale, dust it off, and start figuring out how that's going to work again. Within the primary care field, I think that I can certainly echo Congressman Yarmouth. I don't think that the ACA was ever intended to be the final step in this. It was simply a start, and it made some really great changes that opened up access to people, and yeah, there are some problems with it. Healthcare reform's challenging. If it was easy, we would have figured it out by now. But, it was a first step, and it really opened up the door to a lot of people to allow them access. So certainly, we could make some changes to it, and we could figure out a way to move it forward. But I really find it incredibly irresponsible to consider repealing it without any idea of what we're going to do in its place. Here in Kentucky, we extended health care through the expansion to, 400,000 people? And now all of a sudden, all of those people are looking at going back to where they were before. And I just think that's incredibly scary. We take care of 70% Medicaid within my clinic. And so those are our patients. We see them day in and day out, and we see the fear in their eyes. We see the gratefulness that they have for being able to have insurance and being able to take care of themselves. And I just think that it would be an absolutely tragic thing in this state where we have so many health disparities, and we have so many poor health indicators to pull it back and somehow take this massive step back. So thank you all for being here this morning.
Thank you, Dr. Pendleton. Amy, Sher, consumer.
Yes, consumer. Hello, my name is Amy Shear, and I'm a Louisville-based consultant that goes across the country delivering solutions to fight poverty. I am a mother of 2 teenagers in public schools, and I'm self-employed, as is my husband. I was diagnosed with Crohn's disease when I was 22 years old. I take medicines that would cost thousands of dollars each month if I didn't have health insurance. This disease is also considered a pre-existing condition, which may prevent me from accessing health care in the future unless we all speak up for each other. When the long overdue Affordable Care Act was passed, my family's health insurance premiums dropped more than a third and included robust benefits. Now, my family is paying much more and getting far fewer benefits. This places a tremendous burden on us and other small business people. Our state and federal government officials talk about helping the little guy, the small business person, and entrepreneur, yet in reality, they're creating an environment where only employees of conglomerates will have access to affordable health care, especially the large numbers of people like me with financially ruinous pre-existing conditions like Crohn's disease or diabetes, cancer, or heart disease. And in 2015, there were 57 million small business employees, comprising 48% of all U.S. employees. We pay billions of taxes each and every year and deserve affordable health care. We must unite and send a strong message to Governor Bevin, Senators McConnell and Paul, and to our Congresspeople that affordable health care makes America great and productive. Insist that the Affordable Care Act not be weakened or destroyed. Heck, if we really put Americans first, we'd have single-payer health care like other wealthy nations. We're the 9th wealthiest nation in the world. And we have to struggle to have affordable health care? It's crazy. Keep America great with universal, accessible, affordable health care. Join Kentuckians for the Commonwealth on February 7th in Frankfurt for Stand for Kentucky, and get connected with Kentucky Voices for Health. Share your stories and save our health care. Thank you.
Awesome message. Thank you so much. Representative Johnny Jenkins.
Hey, thank you. Everybody out there nice and cold this morning? Thank you for coming out. Senator McConnell, Senator Paul, Governor Bevin, look at all of these people left out in the cold. They represent all of Kentuckians that are soon to be left out in the cold. We've got to stand up and use our voices. It's not over yet. I want to talk a little bit about what the ACA and expanded Medicaid have done for Kentuckians, especially those that suffer from substance use disorder and mental illness. For the first time, we have parity in private and public insurers. The numbers of folks in Kentucky that suffer from addiction is staggering. I tell folks, if you don't have a personal connection with someone who's suffering from addiction or mental illness, you should go home and get down on your knees and thank your maker, because almost everyone I talk to has some connection. We are seeing numbers of overdoses that are staggering. The number of folks that suffer from these diseases, it's just overwhelming. But for the first time, we are building an infrastructure in Kentucky to provide treatment. The numbers of folks going into treatment paid for Medicaid has increased 700% over the last few years. Those are people who are getting the help that they need to overcome their disease. If they roll back the ACA, it's not only folks on expanded Medicaid that are going to suffer, it's all of us, whether we have private or public insurance. We are not going back to pre-2016. We're going back to prehistoric times. It's time to stand up. Senator McConnell, Senator Paul, Governor Bevin, look at all these folks left out in the code. And if that doesn't move you, shame on you. Thank you very much.
All right, Tony. Our next speaker is Dr. Allison Carden, who's a urologist from Elizabethtown.
Thank you so much for allowing me to be here, and thank you to all of you here today to stand with us. I'm Dr. Allison Carden. I'm a urologist in Elizabethtown, Kentucky, and I'm here on behalf of thousands of doctors and medical students across the country who are concerned and who are standing up for the care for our patients. We're here today to recognize and to honor and to talk about the Save My Care bus tour, which is traveling across the country, telling stories of patients and of people who are going to be affected if the Affordable Care Act is repealed and isn't replaced with something at least as good. You've heard the figure of 30 million Americans will lose their health insurance if the Affordable Care Act is repealed, and 486,000 Kentuckians will lose their health care if the Affordable Care Act is repealed. The important thing to realize, though, is that's a huge number, but every single one of those is an individual story, is an individual person. I have a patient who has been a farmer all of his life. He's self-employed, and insurance is often, really expensive for those people. He didn't have coverage for most of his adult life. He finally got coverage through the Affordable Care Act, and through his screenings and preventative care that was covered, it was actually discovered that he had kidney cancer. So he came to me. I took his kidney out, and ultimately he was cured of his kidney cancer, which is fabulous, and that's due in great part to the care that he had under the Affordable Care Act. But his story doesn't stop there, because if the Affordable Care Act is repealed, he essentially will be uninsurable. It will be impossible for him to gain coverage again because he has a pre-existing condition like cancer. So we're taking this gentleman who, for most of his life, didn't have health insurance. We finally got him health insurance, and now we're going to rip it away. And every single one of those 486,000 people are stories just like that. They're real people.
Medicare for All, it's about solidarity and support for each other. For more information, go to kyhealthcare.org. For Single Payer Radio, I'm Mark McKinley, WFMP 1065, forwardradio.org. Thank you. Go.